Hi folks, and welcome to Health Talk from Marz. It's out of this world. Did you know that 1 out of every 2 adults in the United States now has either diabetes or prediabetes? So, how do you know if you're one of these 2 people? Stay tuned. In 2015, the Journal of the American Medical Association published a startling review stating that 1 out of every 2 adults in the U.S. now has diabetes or prediabetes. So in today's episode, I'm going to tell you 1, what are prediabetes and diabetes? 2, what you can do to diagnose yourself if you have either of these 2 conditions. And 3, what you can do to prevent or mitigate the signs and symptoms of diabetes and prediabetes. Okay, so everyone's heard of diabetes. What exactly is diabetes? What exactly is prediabetes? Well, simply put, if you have an elevated blood sugar that happens like all the time, that is a classic definition of diabetes. But there are some subtle points that you need to know about. And those subtle points are that it's not just sugar that's elevated in the bloodstream, it's also insulin. So most people don't think about insulin as being a problem with most cases of diabetes because they have plenty of insulin. They have too much insulin. So let's use this as an analogy. So let's say you have a busload of people, and that busload of people goes to the front of a hotel. They get let off, they go into the front lobby, they go to the front desk, and they pay their credit card, and they get a key. They take this key, they will go down the hallway, they go to their room, they try to put the key into the door, and it doesn't work. So they go back to the front desk, and they say, the key's not working, give me another key. They go back to their room, that key works, but it doesn't work so well. So they go back to the front desk and they get another key. Pretty soon, everyone's got 3 or 4 keys in their pocket. Well, that's exactly what happens in the vast majority of cases of diabetes and prediabetes. They have too many keys in their pocket because the keyholes are not working properly. So what causes these keyholes not to work properly? Most people think of diabetes as, eating too much sugar. But that's actually not the main cause of diabetes. The main cause of diabetes is that the insulin receptors become damaged for various reasons. Could be oxidized fats could cause damage to those insulin receptors. Something called advanced glycated end products, which I covered in another episode. I spoke about these toxic compounds that we generate in foods when we cook them. Another important factor is lack of antioxidant nutrients, which causes or allows the damage of these insulin receptors. The other thing that's really important, which people don't quite get, is that your insulin receptor is embedded in a cell membrane. That cell membrane is made of certain fats that you consume. So one of the fats, and you've all heard of omega-3 fatty acids, is a critical fat that allows the insulin receptor to respond more appropriately to insulin. So if you have a lack of omega-3 fatty acids in your cell membranes, your insulin receptors are not going to work as efficiently. So those are some important concepts to really grasp and to understand. It's not just eating too much sugar, it's eating too many calories, but also having too many fats in the bloodstream or elevated triglycerides. So let's talk about diagnosing diabetes and prediabetes. So back in the old days, the actual blood parameters were much more lenient than they are today. If you have a fasting blood sugar of between 99 and 126 on 2 separate occasions, you officially have prediabetes. If your blood sugar is 126 or greater on 2 separate occasions, you have outright diabetes. So another way that you can be diagnosed as a diabetic or pre-diabetic is to look at something called hemoglobin A1C. Hemoglobin A1C is a very ingenious test that was developed many years ago that shows your average blood sugar over the last 2.5 months. A red blood cell has a membrane around it. That membrane is made of different types of fats and also is made up of certain level of sugar. So you can think of your red blood cells as little sponges. So over the course of their lifespan, those little red blood cells or sponges absorb whatever sugar's in the bloodstream. So an old red blood cell is going to have much more sugar in it than a very young red blood cell. On an average, your red blood cells are about 2.5 months old. So a hemoglobin A1C gives you your average blood sugar over 2.5 months. And if your average blood sugar over 2.5 months is greater than 5.7 on the hemoglobin A1C, which comes out to about 117 average blood sugar, you have prediabetes. If your hemoglobin A1C is 6.5 or greater, then you have outright diabetes. And that's an average blood sugar of somewhere around 142. So these are the parameters that we want to look at. Now, what's not normally done in labs is to check for fasting insulin. Fasting insulin is a very important biomarker that tells you how sensitive your insulin receptors are. So if you have an insulin level of 7 or greater, then you're starting to generate more insulin than you should to keep your blood sugar down. The other thing is there is a specialty test that you can do called a glucose insulin tolerance test. A glucose insulin tolerance test is where you get a fasting blood sugar and then you drink 75 grams of glucose, and at the same time you also get your insulin levels. So you get fasting insulin and fasting glucose. At 1 hour you get another glucose reading and another insulin reading. And at 2 hours, you get another glucose reading and also another insulin reading. And finally, at 3 hours, you get your final glucose and your final insulin level. So this is a more challenging test to undertake, but gives you valuable information because it shows you exactly what your response is to blood sugar and how high your insulin goes. Normally, your second and third hour insulins should not be any higher than 35 when you add them together. And again, as I mentioned, if your insulin is greater than 7 on a fasting, that is starting to get a little bit elevated. So these are some important markers that you can check for. Another thing that you can do is also measure inflammatory markers in the bloodstream. So one inflammatory marker is CRP, C-reactive protein. C-reactive protein is something that measures inflammation or possible damage to the tissue, possible damage to the insulin receptor. So that's an important biomarker. Another one is fibrinogen. Fibrinogen measures the stickiness of your blood, if your blood's clotting too much. If you have an elevated fibrinogen level, that also can be problematic with regards to your insulin receptors. So, and lastly, knowing your omega-3 fatty acid content in your cell membranes is a really important biomarker that can tell us more information about how well insulin is going to be working. And that's a simple test that you can do, measuring the actual fatty acid content of your red blood cell membranes. And there's a company called Omega Quant that will measure those fatty acids in the cell membrane. Actual diabetes in terms of the symptoms that you might display. Most people don't really have symptoms related to elevated blood sugar, except when it's been going on for years and years. So there are no overt symptoms. So one possible sign that you may have elevated blood sugar is if you have chronic yeast infections, or if you have chronic athlete's foot, or chronic skin condition such as tinea versicolor, which is a growth, fungal growth on the skin. So these are possible signs that maybe you have elevated blood sugar. Another one would be skin tags located up around your upper chest area or neck area. Multiple skin tags can be an indication that your blood sugar is a little bit higher than what it should be. Again, so we want to be proactive in diagnosing prediabetes and diabetes, and so we want to know what our numbers are ideally. So from a hemoglobin A1C perspective, 5.3 and below are my optimal levels for A1C. And for a fasting blood sugar, 70 to 90 is optimal. And as we mentioned, insulin, if your level of insulin is below 7, you're doing really well. If it starts getting up into the teens, we know definitely you're making too much insulin, and that's problematic. So one of the things that can happen when insulin is elevated is the purpose of insulin is to store excess sugar and to store it in the body as fat. And so that fat can go to various tissues, one of which is visceral body fat. So it's possible to measure your visceral body fat with different types of electronic testing. The other thing that we can look for in the liver is something called NASH. NASH is non-alcoholic steatohepatitis. Non-alcoholic steatohepatitis is fat deposits in the liver independent of alcohol, and usually specifically related to elevated insulin and elevated sugar. So these are, again, some important markers to look at that can give you valuable information with regards to diabetes. Okay, so now that we've gone through diagnoses, let's talk about how you can prevent them from happening. I mentioned previously that eating lots of sugar isn't necessarily going to cause you to have diabetes or prediabetes. What's more important is to know that if you're eating oxidized fats would be free radical compounds. Those would be fats that you're eating that are either highly processed or highly cooked. So when you charbroil some type of meat, some type of product that has a lot of fat in it, that charbroil is going to produce advanced glycated end products. Those advanced glycated end products can damage your insulin receptors. Remember that insulin receptors are everywhere on all tissues around the body. So again, the damage can take place in kidneys, it can take place in the liver, it can take place in the heart, thyroid gland, and all other tissues in the body. So, one, in order to prevent, these insulin receptors from becoming damaged, you want to not eat oxidized fats. Two, you want to make sure that the way you cook your food is going to prevent you from making these advanced glycated end products. And three, you want to keep your level of fat down to a minimal. If you're keeping your fats down to a minimal, more likely your triglycerides in the bloodstream are going to be lower, and that's going to prevent those insulin receptors from becoming damaged. Okay, and lastly, which is extremely important, is your calorie consumption. So what we know is as you consume more and more calories, you're going to produce more and more sugar, and more sugar is going to demand more and more insulin. You're going to store that as excess fats in the body. So the Okinawans have an expression when they eat called harahachibu, eat till you're 80% full. And that's an important concept to remember. So one, make sure you don't overeat at one particular meal and limit the number of meals that you eat in the day. So it is really critically important to not eat all throughout the day, because every time that you eat a food, and if it has any carbohydrate in it, it's going to elevate your insulin, and it's going to cause your pancreas to become more stressed out in producing more of this insulin. So what we know is if you can do time-restricted feeding, that is, eat over a narrow period of time, 8 hours or so, that would be great. 8 to 10 hours of time where you're just eating your foods but not eating too much is going to greatly reduce your levels of insulin. Periodic fasting is also something that can be really quite effective at cleaning up your insulin receptors. Every time you fast, if you fast for 3 days or more, you're actually going to start generating these stem cells. Stem cells, when they get generated, are going to be used to replace other worn out or older cells in the body. So if you have insulin receptors that aren't working very well, the body is going to know that. And when you make those stem cells are going to go and replace those old receptors. And that's going to greatly enhance the efficiency of your insulin. So again, every time you fast, and I'm going to refer you to a book, it's called The Longevity Diet, which we talked about in another podcast. And that is an important concept, is periodic fasting. Every time you do it, you're going to get new receptors, you're going to lower your insulin levels, and that's going to lower your blood sugar levels as well. So that is, again, a really important concept to know, and an important concept to follow, because most people, again, we know that 42% of the population of the United States is now officially obese, which is crazy. So those people, the vast majority of them, have elevated levels of insulin and elevated levels of glucose. Most likely they're pre-diabetic or outright diabetics. So we talked about avoiding foods that may cause damage to those insulin receptors, advanced glycated end products, oxidized fats, too many calories. But there's other things that you can do as well to protect those insulin receptors. One of which, and we talked about this in the previous podcast, is to consume a wide array of phytonutrients. So phytonutrients or phytochemicals are compounds found in foods that protect cells. So you can protect your insulin receptors by consuming a high level of these phytonutrients and phytochemicals. You can also take various supplements that will protect those insulin receptors. That would be antioxidant nutrients. So antioxidant nutrients such as vitamin C, selenium, beta-carotene, these all have an effect at protecting those insulin receptors. So I created a product called OxyQuench Ultra that has a number of phytochemicals and phytonutrients that will protect your cells and protect those insulin receptors. Also, we know that there are certain minerals that will enhance the ability of those insulin receptors to bind onto insulin. One of those is chromium. So chromium is a trace mineral that is usually not in very much quantity in most multivitamin supplements. I created a multivitamin supplement called OmniVite that basically has quite high levels of chromium in there. Chromium is a critical nutrient with regards to insulin receptor binding. So looking on your label to see how much chromium your multivitamin has is an important factor in how much protection or enhancement of that insulin receptor is going to be. Thank you for watching my podcast here at Health Talk from Mars. It's out of this world. And if you want more information, you can go to my website, marsnutrition.net, and pick up some additional information with regarding my supplements. So I'm signing off, over and out.